Chronic inflammatory skin diseases such as eczema and psoriasis are common conditions that impact thousands of lives in the UK. Bio-pharmaceutical company AbbVie is committed to partnering with the NHS to help transform standards of care for better patient outcomes and a more sustainable healthcare system.
For 30 years, Kim Dawson has lived with and been hospitalised by a painful, debilitating chronic skin condition. Atopic dermatitis has been her constant companion, leaving no part of her young life untouched by the burden.
It's been in different phases. That's the nature of the disease. So at times it's been relatively mild. Other times I've been on the strongest drugs available to try and manage it. And still that hasn't felt like it's really touched the surface. So I've been in really bad flare situations. And when I say flares, they can last for days, weeks, or sometimes of years. I think the main thing to highlight with living with a skin condition is that it's so time consuming. So these day-to-day things really take up a lot of time, especially when your skin's in a really bad place. So the physical side of it takes a few hours potentially each day, but I think it occupies a really big sort of mental space, and it's something you're always conscious of and always thinking about.
Kim knows only too well how each and every patient is impacted by the way their condition is managed.
You do get sort of a fatigue when it comes to appointments at the doctors at the hospital and new treatments. You think, oh, here we go again. I've heard this before. I've tried this kind of thing, and it does get on top of you. You do get a sort of a treatment fatigue if that's a thing. I think your sort of mentality changes over time, and you sort of think, is this ever going to change? Will it ever be any better?
For Andrew Proctor from the National Eczema Society, managing skin conditions well often hinges on how quickly a patient can see a dermatologist, but the complex nature of chronic skin disease can make it challenging to deliver optimal treatment.
I think for some healthcare professionals, if you don't work in dermatology, you don't see enough to understand just how it can impact and profoundly affect someone's life, their physical health, their mental health, their quality of life, even their life chances. And so I think it's really important that doctors really understand that, and particularly at primary care level for GPs, and to refer on patients where they are struggling. Eczema care is supposed to be stepped. You're supposed to step up to the treatments until you can find one that works. But once you've exhausted that, then people need to see a dermatologist quickly.
The cumulative effect for patients whose condition is not being well managed is profound.
The longer you suffer from a sort of chronic inflammatory skin disease, particularly eczema or psoriasis, the longer and the larger the burden that disease can have on your mental and physical well-being. And really, that cumulative burden just builds up. So if we can intervene early enough, then there's a good chance that we can stop that march, as it were. If you can control the disease well, then you may find that actually what you do is you help to reduce or even prevent the acute utilization of emergency services because the chronic disease is taken care of.
Working with the NHS to drive a better standard of care for those living with inflammatory skin diseases is absolutely critical. And it's here at innovative biopharmaceutical company AbbVie that the focus is on collaboration amongst all stakeholders to really drive through that progress and improvement in those patient outcomes.
Medical Director Belinda Byrne believes patients benefit most when the dermatology community is working together, paving the way for a better patient pathway.
Collaboration is key. We work with the NHS, with policymakers, with patient advocacy groups, with the research and academic communities in a variety of different ways. Without collaboration, we wouldn't be able to achieve the goals that we're looking for. Ultimately, at the end of the day, what we're trying to achieve is better patient experiences and better health outcomes for patients.